This is something from clinic, obviously. So I called Black Winter at emergency psychiatry unit. I'm working at clinic for Lazar Lazarevic. That is the oldest clinic at Balkan, actually one part of Balkan, and established in 1869. So why this winter was so black winter? So during the last winter months at Serbia, at emergency psychiatry unit, we noticed that among all patients, there are a lot of young patients with very severe suicidal attempts. From December 19 through the end of January this year, there are a lot of holidays in Serbia, special days and saints. Starting with St. Nicholas Day, December 19, then going through Catholic Christmas, because 20% are Catholics. Then we have Happy New Year. Then we have Serbian Christmas, January the 7th, called Božić. Then we have Serbian Happy New Year, it's January 14. Then ended with St. Jovan or St. John, January 20. As you all knew, that holidays are the special days when the families are together celebrating. But as a clinicians, you also know, or you knew, that is very risky time when the persons that are alone or felt alone can be very depressive and maybe have suicidal attempts. Also that we noticed, as you can see, this is just to remember how it look like the saints. This is St. Nicholas, and last year, because it's December, it was the part of weekend day that is somehow important. Then was the Christmas, it's a Christmas worldwide. It was also December 25, it was part of the weekend actually. Only the Happy New Year, December 31, it was the Wednesday. It was a very calm day at the night, emergency unit. Serbian Christmas, January the 7th, Božić, it was very hectic. St. John, Sveti Jovan, January 20, part of weekend day also. And Serbian New Year, January the 14th, it was also the part of weekend. What was our aim or aims? We tried to find out are there existing any link or any reason about such a severe suicidal attempts among young population. In this little study, we traced among above all patients in clinic, but for this little study are interested 30 persons, and just one woman, aged 20 to 30 years old. And at the admission, they got diagnosis of acute psychotic episode, and all of these 30 persons, that was the first psychotic episode, and we also noticed that is the status post-mortem suicide. On admission date, mostly diagnostic as bipolar disease, 50% of persons, it was bipolar disease, schizophrenic patients 40%, and major psychotic depression 10%. Among all of these young men patients, because only one was a woman, we notice, and we think it's very important, that most of these young men patients were internet addictions, especially about internet interactive games. Star Wars. Method, obviously, it is a follow-up study about this 3 months. Age, as I mentioned, 20 to 30 years old. Only one person was a female. And what is the severity of these attempts? Because 80% of these young men try to kill themselves on very severe ways. At first, they use tablets, and in that moment, when they were still conscious, they cutting their body with knives, and then use a rope to hang themselves. It means 3 very severe ways in one way. That is severity of these attempts. Only this woman didn't try to hang herself, but she wounded herself with 18 deep wounds in the abdominal region. So at first, the first stage brought her to the clinic and the surgeons survived one very risky and hard long operation lasting 10 hours, and after that operation they brought to our clinic. Among young men patients, I just noticed, and I will repeatedly, they are spending the year before nights and nights, and that is months and months, just on internet, interactive games, and they absolutely stop their social life. Well, maybe it's so early for results, but it's actually, after admission, of course, all these patients are treated at intensive care. This intensive care, of course, included a lot of specialists, not only psychiatrists and neurologists. At first, of course, we traced laboratory tests during all this period, but we need, because of trying to hang themselves, otorhinolaryngologist, cardiologist, surgical controls. At first, they have to get anti-tetanus protection because of a lot of severely wounds. After that, a lot of antibiotic intravenous therapy, and then parenteral, at last actually psychotherapy and pharmacotherapy with our neuropsychotic drugs. So we usually have to use haloperidol or olanzapine, and valproate acid as a mood or affective stabilizer. Of course, we, as a clinical overview, as a clinicians, we control their state, but also we have to measure their state and to find out are we noticed any improvements. So we used a PNSS scale, positive scale for psychotic and schizophrenic patients. And before treatment, we measured 45 and after 21 points. For depressive patients, we used Montgomery-Ashburn scale and Beck scale. As you can see on the Montgomery-Ashburn scale before treatment, they have one very high score, 53 after 12 points, and on the Beck scale it is 63. It means almost the highest score, and after 14. Depressive patients felt better after treatment, after 2 months actually. I talk about medicaments, venlafaxine 150 milligrams per day, olanzapine in night dose, and if necessary, lamotrigine as a mood stabilizer, but not so strong for such a patient, 75 milligrams per day. We noticed demographic that only one woman were married and one bipolar patient. All other patients, 28, were alone. So among all patients, also just half of them started to study but stopped, didn't work, and most of them, 80%, came from broken home families and lived alone. And in this little study, no one patients, above these 30 patients, use any drugs. There were no narcomans, no alcohol users, but there are internet addiction. What was the triggers for such a severe and black winter? Men patient during treatment at first, that is very sorrow to said in the morning visit as a doctor, that they repeatedly told us, "Doctor, we just want to kill ourselves 100%. How is it possible that we have survived? We had done everything to vanish forever." During holidays, if we follow up the slides, we can notice that these holidays was, if we excluded the Happy New Year, it was part of weekends. And before they tried to kill themselves, they called their mothers and father. Everybody, all their mothers and fathers are divorced, but they don't respond to their calls. Also, in that internet games, that used 80% of young men. They were excluded before tentamen suicide. Before that is very special internet interactive games with 8 or 4 participations, and they felt betrayed because they are excluding for this. There are levels in that games, you know, especially the Star Wars games. They felt useless because they didn't work, they stopped studies. Woman in this study, this lady, she was the oldest, 30 years old. That is not the old, but what did she try? Well, her husband accused her that one of his of their children, one of them, didn't look like him. That man, that husband, very primitive person actually, watching a reality show about DNA, and he is very addicted to that show. This winter, a lot of holidays, especially Saints and special days, happen during weekend, and we think it's important in this little study. As a little conclusion and advice for all of us and society, as doctors, obviously, we couldn't change calendar, especially holiday calendar and weekend day that happened. What happened? It is a part of weekend. I don't know. I don't check how it will be this winter. So, but as doctors, we must suggest more internet control and examine how much violence are in that games, and also what is the type of punishment in that steps and levels in interactive internet games. So that is the most popular among younger generation, because that type of punishment maybe can be some idea trigger for such a suicidal attempt. Also, we must suggest social workers to work not frequent as we are the urgent psychiatry unit. We work non-stop, every night, every day, all year. But for the weekends and for special days, in Belgrade there are some social worker on duty on telephone call, but that is nothing for the 3 million people city. Also, for one suggestion for social workers to trace the young people who lived alone after divorce their mother and father. And our voice, all of us, must be much louder on the television about reality shows. You knew how many damages happened after that reality shows. There are a lot of shows, but some of the shows, for example, that DNA reality shows, are full of suspicions and persecution about child, that is very unfortunately very popular, because it is cheap. People couldn't afford in Belgrade to give money to pay DNA tests, so they are in front of the camera, control and check are they one of their child, are they really their child. Also, after treatments, if we have such a severe suicidal attempts, our control as a doctors and psychiatrists must be more frequently, not to tell patients, okay, we can see each other after 1 month. I think in such a severe situation, the control must be at 1 week, the first month after the exmission day. Thank you for attention. It was very sorrow theme, but any questions? And to continue with something totally different about migrant crisis, about suicidal. No, it is noon. The sun is shining. Okay, next one. It's our little.
You have to make the presentation in 10 minutes, but because we have to clear the room.
Yes, this is very short.
Okay, thank you.
It is just our little experience about last 5 months, what's happening. migrant crisis, it's our experience with migrants at psychiatry. Migrant crisis experience from our urgent psychiatry unit. So during the last 5 months, just 8 persons admitted at psychiatry Belgrade unit at Clinic Laza Lazarevic. Age of this man, all of the persons were male, 20 to 39 years old, and we examined but not admitted 31 men patients. They came from Libya, Pakistan, and Mauritania. Well, what can be the aim? We just want to share our experience with such a sensitive population. From 8 patients, 6 of them got diagnosis of acute psychotic episode according to ICD-10 classification, and clinical overview noticed agitation, lot of hallucination, especially imperative hallucination, persecution ideas, and homicidal tendencies. One man, among these 8 persons, got epilepsy, had epilepsy seizures, grand mal type, and diagnosis G40. And one man, that man was from Mauritania. Actually, the security noticed at the clinical center of Belgrade, that is 1 kilometer from our hospital, one man jumping and walking to the roofs. So the security guard and noticed that and support team thought actually that they wanted to jump. They survived him and brought him to our clinic. I was on duty, and that man told me, "Doctor, je suis malade sérieuse," and showed me that he used alprazolam plus clonazepam and aripiprazole. So he also told me that medication prescribed in France, and that he was from Mauritania. We have the youngest person among 8 persons was paranoia, 20 years old. Patient came from camp because he tried to kill his brother. He had a lot of, actually, all symptoms of paranoid schizophrenia, of paranoia. He called himself as a lag. That is not surprising us as doctors in such a situation with migrants, but he had very imperative ideas, severe insomnia, homicidal tendencies to his older brother, but not only to his older brother. We have, after the older brother came to our clinic, he gave us information that this young man has already been treated in Libya with flufenazine decanoate, moditindepo former injection. Every 4 weeks he got that injection, and olanzapine 20 milligrams at night. But obviously during migrant crisis he stopped with therapy, and without 3 months therapy you can imagine how acute paranoid and psychotic severity of his clinical overview was be seen. So method follow-up study of this 8 patients with psychiatry problems were men, of course, that we traced laboratory tests, EEG, cardiologists, dermatologists, because of a lot of wounds and on their foot. And the results about hospitalized migrants, we also use PNSS scale to see, not as clinicians, but to have some proofs about treatment. We use a positive scale, mostly 45 before treatment, after 17. And after 4 weeks, we examined they get out from the clinic, and we gave all of that patients got medicaments for next week, and strictly direction for support team that will follow them to the camps. For just one young man that he had brother, the other persons told us they didn't have any family at all, not in Libya, not in Germany, not in, well, we have to believe we are just doctors, we are not inspectors. And as a treatment, we can suggest as doctors that olanzapine, oral dispersible tablets, can be very useful, and to avoid haloperidol, because this popularity of Libya, Pakistan, Mauritania persons are very sensitive for such a neuroleptic. and lorazepam, of course. And what about 35 examined but not admitted patients? All of them were addicts. Different addiction we noticed. They used opium, hashish, heroin, methadone, and what surprised us, as we knew that we have already seen everything, but some of them abuse lidocaine or xylocaine that dentists obviously use for anesthesia, but they drinking lidocaine with high percentage as liquids. So we, of course, have to detoxicate them and use all laboratory tests. We notice very severe liver diseases, damage, and 10% of these patients was HCV positive. After detoxification, they were admitted to Institute for Addiction. And this patient didn't tell us how they got such drugs or liquids, because some of them are very rare. I think about lidocaine. And of course, once again, we are not inspectors, we are just doctors. Thank you for attention.
Thank you for being here.
Any question?